Thank you, Deputy Speaker, and I am so pleased to be speaking in support of this bill today, which delivers on one of our government's very important election commitments. And it's actually been a huge day for this government delivering on election commitments. We've had introduced today our legislation for cheaper childcare. Thank you, Minister Ali. We have had our legislation for a National Anti-Corruption Commission introduced today. And in fact, we've also had our legislation for the Respect at Work amendments, which will really make Australian workplaces a safer place for women. And now this legislation around making medicines cheaper for Australians. Really important reforms, all of these, that directly affect the lives of people in our communities. Because that is what this government is about. We are about introducing changes that make this country a better place, that directly affect lives. And I do have to reflect, having spent 3 years sitting on the other side of this chamber, that was certainly not my experience during those 3 years when, in fact, we came into this chamber for bills that were really about presenting a political wedge, but not about things that impact people's lives. So, as I said, I am so proud to be standing here today to talk about this important piece of legislation, delivering on our election commitment, but also, importantly, really making a difference to the lives of people in my community and to communities right across Australia. And of course, there are challenges that communities across Australia are facing at the moment. And as the federal government, it is for us to do the best we can to support people and to make sure that we are making their lives easier where we can. I do know this bill will make a difference in the lives of people in my community. Whether you're in postcode 3081, 3087, 3088 or across Jagga Jagga, I know you're facing cost of living pressures. I know that this bill, making medicine cheaper, will make a real difference in your life. Put simply, this bill is about making medicines cheaper. It's part of our plan for strengthening Medicare and strengthening the pharmaceutical benefits scheme. In the last few years, we've seen cost of living pressures continue to impact across our country. And I have had many people in my community, particularly older people, I think, when it comes to the cost of medicines, come to me and talk about how day by day, week by week, these costs are adding up. And they haven't felt in the past, prior to the past election, that they had a government that understood and was taking action on these cost of living pressures. And we know that when people are facing these cost of living pressures in these areas, that sometimes spending on medicines can be one of the areas that goes. And that, of course, should not be the case in a country like ours. People should not be facing difficulties getting access to affordable medicines. While there's no single fix to cost of living pressures, what our government is doing the bits that will make a difference in people's life to deliver some relief, to get the support that will help make a difference in those day-by-day, week-by-week budgets and pressures. Through our government's reduction to the PBS general co-payment, we will be putting more money back into the pockets of Australians. And this is the first time in the 75-year history of the PBS that the maximum cost of general scripts will fall. Under this bill, the cost of scripts is being cut by 29%, with the maximum cost to drop by $12.50, dropping the price overall to $30. And so for someone, say a parent or a grandparent in my community who might be filling one script a month, they could save $150 a year. For a family in my community that might be filling 3 scripts a month, this change means every year they could save $450. That is a substantial difference. By cutting the price of medications by nearly 1/3, we're ensuring that more people can afford to get the medications they need to stay healthy without having to worry so much about the price. And of course, we know that in addition to the cost pressure, there is that worry pressure for people around how they are making sure they and their families stay healthy. And we do want to reduce that burden as well as the cost pressure, because medicines aren't an optional extra. They're essential, and they shouldn't be the thing that people are cutting from their budget. Since 2000, the price Australians pay for prescription medications has doubled, which is putting more and more pressure on those who are filling their scripts every month. Under this measure, our government is helping to address this by putting close to $200 million back in the pockets of Australians each year. This change will benefit about 19 million Australians, and 3.6 million Australians will immediately benefit when these changes come into effect from the start of 2023. As the Minister highlighted in his contribution to this debate, the PBS has a long history, and it's a proud Labor history. It was due to the hard work of two Labor giants, John Curtin and Ben Chifley, that the PBS was introduced in the 1940s, despite pushback from others of the time, including the Liberals. So I can assure those in my community and beyond that under our government, the PBS will continue to be supported. We are committed to seeing the PBS work as well as it can in providing it as an avenue for people to access medicines at an affordable price. We do know that, as I said, making medicines cheaper needs to be just one part of our plan to reduce the cost of living. And again, I point to the cheaper childcare reforms that our government brought in this morning. This is another significant cost that families face, and it's a cost that, again, has really significant costs if people are cutting back on being able to afford and access childcare. So there's absolutely more for us to do, and we're getting on with it. There is, of course, more for us to do in health. Before the pandemic, we knew there was work to do to make our country's health systems the best they could be. And post-pandemic, that has obviously been reinforced. It is going to take hard work from our government and from governments and from service providers across the country to make sure that Australia's health system is robust and as strong as it should be, that it provides the care that all of our communities rightly expect. Our government is taking the challenges in our health sector seriously. Beyond this bill, it is an area that we are focused on and that we will continue to focus on. And I recognise in my home state of Victoria there are significant commitments also being made by our state government, who are sharing that focus on supporting the health sector and the workers who keep it going every day. And my electorate is home to a sizable medical precinct, the wonderful Austin Hospital, the wonderful Mercy Hospital, Warringal Private Hospital. We are very fortunate to have some wonderful healthcare locally. And because of that, we also have wonderful health workers, doctors, nurses, administration staff, cleaners, many others either call Jagga Jagga home or are working in my electorate. And I do want to take this opportunity while I'm talking about our health system and how we make it as strong as possible to once again thank all of those workers for the extraordinary work they have done throughout the pandemic and that they continue to do today. We have in my electorate recently seen a fantastic commitment from the Andrews Labor government, which will upgrade the emergency department at the Austin, which reinforces once again that it is Labor governments at both state and federal levels that deliver on health. We know that when the costs of medicines are too high, we do see situations where people feel they have to make an impossible choice between getting the healthcare they need, providing for their family, or in fact putting their health at risk. And my colleague, the member for Robinson, did a wonderful job of explaining the very real consequences of that he's seen in his work as a health professional. I'm sure we'll hear from the member for Kooyong about her perspective as a health professional on that, and we certainly benefit in this place from having so many people with direct experience here. According to the ABS, in the 2019 to 2020 period, there were close to 1 million Australians who delayed getting a prescription filled or didn't get it filled at all because of costs. And that's a situation our government doesn't want to see anyone having to face, for them or for a family member or a friend. We also know that from recent data that nearly 2 in 3 Australians have been provided with at least one PBS medicine. So it's clear the PBS is well utilised and it is a benefit to our overall health system. It's something that people do rely on. As people age, or for people with a disability or experiencing health conditions, there is an increased likelihood that they will need to be supplied with medicines. And if you are not personally someone who receives medicines on the PBS, you would, of course, have friends or family members who do. For people who need multiple medications, The situation with prices has meant that they've had to decide between medication for immediate relief of pain or other symptoms, or medication that will support improvements to their long-term health. And in the cases where this choice has come up for people, it's understandable that they've chosen to look at that short-term fix and then potentially exacerbating long-term conditions. This is not a situation that we want people to be facing. It's not good for them or for our wider community. Every Australian should be able to access world-class and universal medical care. It is actually one of the things that I think really sets our country apart from others, that in our community people know that if they need care, they will get it, and they will get it at an affordable price that shouldn't send them to situations where they are feeling like they are making unacceptable choices or facing unacceptable levels of debt or cost pressures. So by making medicines cheaper, we are supporting some of the fundamentals of our health system, and we are helping to address the cost of living pressures that I know many in my community and other communities are experiencing at the moment. Importantly, no patient will be worse off under these changes. Pharmacies will still be able to offer optional discounts in situations where the Commonwealth price is between the new and current co-payment amounts. And the savings this will deliver for Australians will continue over coming years. The general patient co-payment will continue to be indexed each year. From the start of 2024, it will be calculated off the new co-payment amount. This bill before us will make a real difference to people and families in my community and to communities across the country. It will make a real difference to household budgets, and it will help to relieve cost of living pressures. It is just one of the many ways our government is taking action to deliver on our election commitments and to respond to the needs of Australians. We're not wasting time, we're getting on with it because we know that people are looking to us for reforms that make their lives easier, that make this a better country for all of us. We are making medicines cheaper, and more broadly, we will be making it easier for people to see a doctor and to access a world-class health system. Labor's record in this space speaks for itself. We built Medicare, and we will always protect Medicare and do the work that is needed to make sure that it continues as one of the fundamental underpinnings of our health system. The system that people know means that they can see a doctor and do so in an affordable way when they need care. We built the PBS, and we will always protect the PBS. Again, as I've explained, we know that people have been facing some really difficult choices when it comes to the cost of medicine and when it comes to making those decisions around their household budget, around whether they are deciding to take perhaps all the medicines that have been recommended for them. And we have heard as part of this debate conversations that people have been having with doctors or pharmacists about, well, do I really need this one this month, or can I just choose to take this one for this week, because they weren't sure that they were going to be able to afford all that had been prescribed for them. That is absolutely no way to run our country's health system. That is not a choice that Australians should be facing. It is a choice that our government is trying to make sure no one will be facing into the future, that families will know they will be able to afford the medicine for their children, that older people will know that when they have complex needs, they will be able to afford all the medicines they have been prescribed. That's what this bill is about. It is about making sure that we have a health system that delivers for our country and our communities now, but that we have a health system that is also built to deliver into the future, that makes sure that people in this country know they have affordable access to life-saving medicines, and I commend this bill.